What is the science behind fertility awareness methods? Imagine understanding your body so well that you can tell when you're most likely to conceive or avoid pregnancy just by paying attention to natural signs. That's the core idea behind fertility awareness methods. These are natural family planning techniques that relying on tracking specific biological changes during your menstrual cycle. The science behind these methods is based on the fact that certain physiological signs change predictably around ovulation. The time when an egg is released from the ovary and pregnancy can happen. One of the main signs used is the menstrual cycle itself. Most women have cycles lasting between 26 and 32 days. Fertile days usually happen around the middle of the cycle, roughly between days 8 and 19. This is when ovulation is most likely to occur. The standard days method uses this general timing to estimate fertile windows, especially for women with regular cycles. Another key indicator is cervical mucus. Around ovulation, the body produces more mucus that becomes thin, clear, and stretchy, similar to raw egg whites. This mucus helps sperm swim and survive inside the reproductive tract. After ovulation, the mucus thickens and becomes less noticeable. By observing these changes daily, women can identify their fertile days more accurately. Basal body temperature is also important. It's your resting body temperature measured first thing in the morning before getting out of bed. After ovulation, progesterone causes a slight increase in body temperature, usually about 0.3 to 0.5 degrees Celsius. Tracking this temperature daily allows women to confirm that ovulation has occurred, as the temperature shift is a reliable sign. Some women combine these signs in what's called the symptothermal method. This approach looks at cervical mucus, basal body temperature, and sometimes cervical position or other symptoms to better pinpoint fertile days. The idea is that combining multiple signs increases accuracy. The science behind these methods is that ovulation and fertility are linked to these observable physiological changes. By tracking them carefully, women can predict when they are most fertile or least fertile. When used perfectly and consistently, fertility awareness methods can be very effective, with only about 1 to 5 pregnancies per 100 women in the first year. However, typical use, which includes mistakes or inconsistent tracking, results in higher pregnancy rates, around 12 to 24 pregnancies per 100 women annually. It's important to remember that these methods do not protect against sexually transmitted infections. Using barrier methods like condoms is necessary if STI prevention is a concern. Fertility awareness can also be used to help achieve pregnancy by timing intercourse during fertile days. From a healthcare perspective, fertility awareness methods offer a non-hormonal, natural option for family planning. Proper education and training are crucial to improve effectiveness. It's also worth noting that individual cycle patterns vary, so these methods work best when women understand their own bodies and are committed to daily monitoring. Always consult a healthcare professional for personalized advice and support. In summary, the science behind fertility awareness methods is rooted in observing natural, measurable changes in your body that reflected your reproductive cycle, helping you make informed decisions about fertility and family planning.